A very good afternoon to one and all present over here. I myself, Dr. Neha Singh Mandade, from Indian Association of Physiotherapists Digital Media Team, would like to host today's webinar on physiotherapy's pivotal role in oncology rehabilitation with our resource person, Dr. Nikhil Chakravarthy sir. This is being organized by Krishna District of Andhra Pradesh, IAP Women's Health. For today, we have with us District Coordinator Dr. Sri Praveena ma'am and District Sub-Coordinator Dr. Ramya Sri ma'am. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since the year 1955. The IAP digital media team consists of a group of physios who handle Zoom platform, webinar live streaming, and IAP profiles on social media platforms like Facebook, Instagram, Twitter, LinkedIn, and YouTube. You may follow us and at IAP profiles on these all social medias to receive notification for our events such as webinars, workshops, CMEs, conferences, health camps, and blood donation drive to know more and stay updated in physiotherapy. Subscribe to our IAP YouTube channel for notification of our live webinars. In the playlist section of this channel, the webinars are segregated into various folders on topics like orthopedic, neurology, sports, fitness, pediatrics, cardiopulmonary, women's health, research, cancer rehab, etc. for your easy access. The social media link for this webinar live streaming would be shared in the chat box shortly. Now, I would like to hand it over to Dr. Sri Praveena ma'am, who is District Coordinator of Krishna District in the state, Andhra Pradesh. Over to you, ma'am, for the conduct of the webinar. Thank you.
Very good afternoon to one and all. It's my privilege to introduce our speaker for today's webinar. I, Dr. Sri Pravina, I would like to welcome you all on behalf of IIPWC Krishna District for the series of webinar. Today's topic is physiotherapy pivotal role in oncology rehabilitation. It gives me a immense pleasure to introduce our speaker for today's webinar. Dr. Nikhil Chakravarthy is a highly accomplished physiotherapy professional with extensive in cardiopulmonary rehabilitation, fitness training, ergonomics, and oncology rehabilitation. A graduate of the prestigious Manipal University, he has built a career in spanning more than a decade in clinical practice, leadership, and patient-centered rehabilitation. He began his professional journey at Manipal University, Bangalore, when he served as a senior physiotherapist for 5 years. During this tenure, he gained extensive experience in managing complex cardiopulmonary, neurological, musculoskeletal, and critical care rehabilitation cases, while working within multidisciplinary healthcare teams. Dr. Nikhil joined Yashoda Hospitals as in charge of physiotherapy services in the leadership role. He was instrumental in strengthening rehabilitation services and played a significant role during the challenging COVID-19 pandemic period, providing rehabilitation support for critical ill and post-COVID patients. Currently, Dr. Nikhil serves as a head of the Department of Physiotherapy and Rehabilitation at Baswatarakam Indo-American Cancer Hospital and Research Institute, one of the India's leading comprehensive cancer care institution. The hospital is recognized as a premier oncology center dedicated to achieved cancer treatment, research, and rehabilitation services. Throughout his career, Dr. Nikhil Chakravarthy sir has remained committed to evidence-based practice, functional recovery, and improving quality of life for the patients. Over to Nikhil sir. I hand over the mic to Nikhil sir.
A kind request to all the participants to put up your queries in the chat box. And towards the end of this webinar, all the questions would be addressed by the speaker. Thank you, everyone.
A very good afternoon to everyone. First of all, at the outset, I would like to thank the IAP Women Cell, and also I would like to thank Pravina, Krishna District State Coordinator, for giving me such a lovely opportunity to conduct to be a part of this webinar. So, without any further delay, I would like to get into the topic, today's topic, that is physiotherapy's pivotal role in oncology rehabilitation. So, I would like to ask the participants to be very interactive and ask me a lot of questions in the chat box, which I will be answering at the end. And I wanted this to be a very interactive session so that you can ask me many questions. And the reason for me to choose this topic is because these days, as we all know, that the incidence of the cancer is very high. So I think it is everybody's responsibility, and it is equally important as a physiotherapist to address all the cancer patients and do the needful to the society. So we will start with the definition. I hope everybody is able to see the slides perfectly. Hello?
Yes, sir.
Yeah. My slides are visible? Yeah.
Yes, sir. You may take it to slide share. Yes. Thank you.
Done. So to begin with, we'll just start with the definition. That is, earlier the cancer was a disease in which some part of the body cells used to grow uncontrollably, and we had the notion that they spread to the other parts of the body. But later on, with the advancement of science, and then they have done a lot of research and they have modified the definition, in which they have found that there is a genetic link as well as gene mutation, and then they have given a new definition, that is, again, it's a disease of uncontrolled proliferation, that is the growth by transformed cells, that is, there is a mutation subject to evolution by natural selection. So this is the updated version of the definition which they have come up with the later on version. And I request everybody to look at the end of the slide, that is each slide wherein I am quoting the references. So make sure you see those references also. So this is the definition. Then for me, why it is important to choose this topic, as I was telling you, is cancer, as we know, it has become a significant global health concern, with India ranking second in the Asia and third in the world. So it becomes really important and need for the hour to address the cancer patients. So I think the prevalence is very high. So I think we should take care of all the cancer patients and do the needful from the physiotherapy perspective as well. And being a cardiopulmonary physical therapist, so what usually comes whenever you think of a cancer is, you doctor, whenever a patient comes to a cancer hospital, usually doctor gives him three options, that is, you can either go for a surgery, or you can go for a chemotherapy, or a radiation therapy. So, as a cardiopulmonary therapist, my primary motive was always to study the cancer related fatigue. So, why it is important? As we see in this slide, the cancer related fatigue is one of the most common and complex symptoms experienced by most of the cancer patients. And the prevalence of the cancer related fatigue is approximately 50% of patients with cancer. That is, in this slide, you can see how many patients are actually having cancer related fatigue. So, it becomes really important to address this cancer related fatigue, wherein a physiotherapist has a major role to play. And it is also characterized by cachexia, that is, loss of body mass and also the skeletal muscle. So again, the National Comprehensive Cancer Network defined cancer related fatigue as the most distressing, persistent, subjective sense of physical, emotional, and also cognitive tiredness. So that is why it becomes important as a physiotherapist and also for the rehabilitation of the cancer patient that it should be a holistic approach, because there is a physical component which is involved and also the component of cognitive component is also involved. So it becomes important that a multidisciplinary team, that is along with the physiotherapist there should be a psychologist, sociologist, as well as there is a nutritional deficiency, you have equal importance for the dietitian, and all these people put together they form a multidisciplinary team, then they can do a proper rehabilitation for the cancer patients. And then the National Comprehensive Cancer Network even defined as exhaustion related to cancer or the cancer treatment. Then whenever we come for the causes, as we all know, the disease cancer itself can cause the cancer related fatigue, but ironically the treatment, which the treatment options also enhance the cancer related fatigue, that is the surgery, the radiotherapy, the chemotherapy, and also the hormone therapy. All these treatment options which are available to treat cancer also cause cancer related fatigue. So it becomes very important to address the cancer related fatigue, which is the most common and a very prominent symptom which is seen in approximately 50% of the cancer patients. And as we know that cancer is a progressive disease and it needs multiple medical interventions, there is a lot of mental stress and also physical impairments which cause dysfunction of neuromuscular and also skeletal structures. So whenever you have a compromised functional ability, it leads to physical inactivity. And whenever you have physical inactivity in place, again, the quality of life is impaired and there is a generalized weakness. So assume if a patient is there, wherein a patient is diagnosed with cancer, automatically patient most of the times becomes physically inactive and his quality of life will be impaired, and then you will have generalized weakness and causing deconditioning. So all these symptoms are modifiable by a physiotherapist, so it becomes our primary source of treatment. And balance again is very strongly related to muscle strength of the lower extremities. So whenever your lower extremities are very weak, again you will have balance issues, and it is very evident and it is there in lot of articles, that is lot of chemotherapy agents also cause peripheral neuropathy. And whenever you have balance and peripheral neuropathy put together, again the risk of falls is very very high. So again coming to the fatigue, which is an activity limiting symptom, also affects cancer patients functional capacity. So as we were discussing till now, fatigue also becomes important symptom which needs to be addressed. And last but not the least, pain, wherein in most of the articles it is referred to as excruciating pain, especially in people who have cancer. So pain should be addressed first, and it has a significant variable which influences the quality of life. And when you do a proper assessment and you measure the all the physical impairments, it becomes very important to plan a rehabilitation program, so that you will take all these things into consideration, that is your balance, your strength, your fatigue, your pain, your risk of fall, and all these things also become very important to plan a rehabilitation program. So that is why I would suggest all the newcomers or upcoming physios or young physiotherapists, make sure your foundation or the assessment is very strong, so that you will do a proper assessment and then you will be able to do a tailor made program. Then as we are all physiotherapists and our prescription is the exercise, so exercise again is increasingly becoming very recognized as an important treatment for the recovery and also the rehabilitation of cancer survivors. And the benefits which include are the reductions in fatigue levels, and it improves your immune function as well as the physical functioning and also the quality of life. This I have taken from a systematic review, the exercise and cancer rehabilitation. And again, as we discussed, that physical exercise has been documented impact on health and is associated with reduced risk of mortality. I think everybody should have a focus on this point, that is, whenever if somebody is physically fit, the chance or the risk of mortality is also reduced. So that is why we encourage all our cancer patients also to be very active, and exercise has shown to be a preventive effect on the risk of cancer. That is why according to ACSM also, there are certain guidelines which tells you with the prescription of fit, wherein a person has to do some sort of exercise at least 5 times a week or 4 times a week. And it is also evident that your chance of having a cancer is also reduced. And physical activity has been reported as associated with lowered risk of disease reoccurrence. As a physical therapy HOD, as I'm working in a cancer single specialty cancer hospital, we have seen so many cases of reoccurrence of cancer. That is why we suggest most our patients that they should be physically active even after they go back home after the surgery, or even while they are actually getting treated. So the most important part would be, which is very underrated, is your physical activity. One should be active even when he's going through cancer treatment. It is little challenging, but if done in a right way, it is possible, which will help you to reduce the risk of the disease reoccurrence. Then the effects of physical exercise on cancer related fatigue. This is a meta-analysis wherein they have suggested that supervised exercise programs have been very feasible therapy in management of cancer related fatigue. So I think whenever somebody is supervising the patients and then they are actually teaching them the exercises, then it will be very feasible and it helps to manage the cancer related fatigue as well. Then again, coming to exercise prescription, usually most of the times in acute phase, once the surgery is done or when the chemotherapy is going on, the intensity of the exercise should always be low to moderate, and with frequency at least 3 to 5 times a week. And the exercise duration should last minimum up to 20 minutes, involving aerobic and resistance exercises. So most of the times, again with the age, you will have sarcopenia and also the cachexia in most of the cancer patients. So that is why strength training or the resistance training with elastic bands or with weights is also needed. So again, the most this term has come, at least from the last 5 years, this term has become very, now it has come into the limelight, that is the prehabilitation. So this again is from a systematic review and a meta-analysis what we have been doing in our hospital, that is the effect of total body prehabilitation on post-operative outcomes. So what is prehabilitation? Prehabilitation is nothing but preparing the patient for the surgery. So it becomes very important that patient is actually fit for the surgery and he should be in a position to do all sorts of exercises, and he should know what is going to happen with him in the ICU as well. So I think it becomes really important to teach the patient what is going to happen with him, what will be his challenges later on, and how he can be fit for the surgery. So this is called prehabilitation. So this is the difference between prehabilitation and rehabilitation. Rehabilitation is usually done after the surgery. Prehabilitation is done something before the surgery, so that the outcomes or the patient recovery will be very effective and soon. So outcomes usually include the length of the stay in the hospital or the functional capacity and perioperative complications, and all these things will be the outcomes whenever you teach a patient the prehabilitation program. And usually the program includes flexibility training in the calf, hamstrings and quadriceps. That is, most of the times prehabilitation we teach, assume a patient has come for a surgery, it is like an abdominal surgery, a patient has a CS stomach and he has come for to get operated, that is the gastrectomy surgery. So most of the times what we try to teach them is their hamstrings, their quadriceps and their calf muscles should be very strong because they have to walk early. Then again the hips and the shoulders again should be strong enough. Isotonic and isometric exercises are taught, as well as we use the therabands and weights also, wherein we will teach some resistance exercises so that they will be able to recover early, and the drains which are there will also come out early. So this is a simple brochure wherein in our hospital we are practicing, we give this brochure so that they can see this brochure. It is given in both the languages, that is English and Telugu, so that patient need not by heart these exercises. When he comes to the OPD, they can actually go back home, read the brochure, go through the brochure, and then do whatever is needed. The most important aspect what I have seen in my decade of practice is, most of the times whenever you have an abdominal surgery or a thoracic surgery, there is something called as dysfunctional breathing. So usually your breathing control goes for a toss. So it becomes really important as a physical therapist to teach the appropriate or the right breathing pattern, because it is very well documented that once there is an anesthesia which is given, the diaphragm, which is the chief inspiratory muscle, it has diaphragmatic palsy, that is your diaphragm will become weak. So you need to retrain the diaphragm. So in this prehabilitation program, the key focus is on training the diaphragm, that is teaching the patient how to do diaphragmatic breathing, as well as to increase the lung expansion. We give them spiroball, that is your intensive spirometry. And then people, most of the patients who come for us are breast cancer patients in women, wherein the prevalence is very high these days, the incidence. And then we teach them the shoulder exercises, wherein the shoulder will also become strong, and then they'll be able to attain their full range of motion. And head and neck cancers, again nowadays the prevalence is very high, so you teach them the head and neck movements. And last but not the least, which is very commonly seen, is the prostate problem, which is seen in men. So we try to teach them the pelvic bridging as well as Kegels exercises, so that their recovery or the incontinence issues will be addressed. So all these would be a very helpful tools whenever you try to teach the patient early, so that the patient is also mentally prepared and he is also up for the surgery. So this is about the rehabilitation. And we have a QR code as well in our hospital, wherein a patient can scan and there will be a full video which will be playing, wherein we can see how exercises can be done. It can be in both the languages, again English and Telugu. So this is about the prehabilitation QR. And once the surgery is done, assume the patient has come for prehab, we have done a brilliant prehab, then the patient goes to the ICU. Now it becomes really important in the ICU that we are talking about this concept called early mobilization. Early mobilization obviously enhances your recovery after any surgery. So early mobilization again is a very crucial component of the enhanced recovery to counteract the adverse physiological consequences of surgical stress as well as the immobilization. So early mobilization helps to reduce the risk of postoperative complications, as well as it accelerates the recovery and positively impacts several patient reported outcomes and reduces your length of the hospital stay. So you need to make sure that your patient is not confined to bed, and try to mobilize him early, so that his respiratory parameters and all these things will also come back to normal once the patient is mobilized early. So in this article, what they have referred to early mobilization is transferring the patient from bed to chair, that is trying to pull out the patient from the bed. Don't get confined to bed. Most of the times I tell all my ICU patients, then again trying to stand up and sit when he's in chair, then exercises in or out of bed, some basic exercises, that is your upper limb, lower limb, and also making sure that he's walking enough so that his airways also open up, there is enough lung expansion which is happening whenever you have walking also. So this is a small video which I can play, wherein how we deal in the ICU, that is how we teach them the dynamic quadriceps exercises. Along with, we have made the patient sit in the chair. He was a patient of gastrectomy, that is CA stomach, and then we have made the patient sit. And the most important, usually what we have seen is, once the patient is having quadriceps weakness, the patient might buckle and fall. So that is why it becomes really important that patient does dynamic quads. And as I told you earlier, the most important aspect would be again the breathing part, that is your incentive spirometer. So encourage the patient to do the incentive spirometer as well. And this is again the early mobility in the ICU. That is, if the patient is in the ICU with all the drains, make sure he is out of the bed gently, take physio's help, and then try to mobilize him early so that the outcomes or the parameters would reach normal and there will be an enhanced recovery. So this is once again. So again, coming to most of the times, this is one more topic wherein we actually have a lot of patients. That is again the mirror therapy, which is used for the elevation of phantom limb pain. So whenever we have a lot of cases these days regarding osteosarcoma, that is of femur, wherein the patient is asked to go for an amputation, and then there is a lot of pain which is referred to as phantom limb pain. And as we all know, that phantom limb pain is very debilitating and affects 50 to 85% of patients following an amputation, and it significantly diminishes their quality of life. So the prevalence of phantom limb pain is almost very high in most of the amputation patients. So I think mirror therapy has been reported to have a potential success in elevation of phantom limb pain. So whenever you have this evidence, you can start using the mirror therapy to most of the patients so that their phantom limb pain can be addressed. So the clinical aspects of mirror therapy in rehabilitation, this I have taken from a systematic review. We will just see how the mirror therapy actually works and how it is done. So in mirror therapy, usually the patient sits in front of a mirror that is oriented parallel to his midline, blocking the view of affected limb positioned behind the mirror. When looking into the mirror, the patient sees the reflection of the unaffected limb positioned as the affected limb. So basically, if you have a leg after the amputation, you are actually trying to, yeah, there is a video wherein which shows mirror therapy. See, now the patient is able to see his leg in the mirror. That is, his right side leg is amputated. Then we'll ask the patient to look into the mirror and then try to address the phantom limb pain. So you need to design a mirror in such way that patient actually sees into the mirror and try to address this. So this is mirror therapy which we do post amputation. Then the next highest prevalence would be again the breast surgery patients, wherein again I was talking in prehab itself. That is, the patient should be well counseled and trained about what will happen and everything. Again, this we have taken from a BMG article. That is, the objective of this study was to determine the effectiveness of early physiotherapy whenever in reducing the risk of secondary lymphedema after the surgery of breast cancer. So in this, there were 120 women patients who were there after the breast surgery. That is, it was involved with the dissection of the lymph nodes. And what was the intervention given was manual lymph drainage, massage of the scar tissue, and also progressive, active, and action assisted shoulder exercises. So this was the article which was there. And what was the outcome measure? That is, the incidence of the lymphedema was very less, and conclusion was early physiotherapy would be effective intervention in the prevention of lymphedema. So whenever you have a patient with lymphedema or post breast surgery, you need to start your intervention. That is, you need to mobilize your scar tissue as well as you need to teach them the active exercises so that the lymphedema chance is very less. So so even in this, we try to give the patients the brochure, wherein it is very self educating brochure, wherein we teach them what are the exercises which needs to be done. And post mastectomy, that is, you have a home program which is being given even after discharge, what are the exercises which needs to be done and what are the do's and don'ts, so that it will not get lymphedema will not get triggered. So this is again the brochure which we share with the patients in cases of the breast cancer, wherein you can avoid the lymphedema. And then the last one would be the palliative care. So in cancer, again, this becomes a really important department, wherein palliative care means to make less severe. So in palliative care, to palliate means to lessen the severity of the symptoms of an illness without curing or removing the underlying cause. So basically, in palliative care, you cannot control the disease or you cannot neutralize the disease. You can just make the symptoms severity very less. You cannot cure it. So this is about the palliative care. So palliative care improves your quality of life of the patients and also their families who are actually facing challenges. So worldwide, ironically, only 14% of the people actually are receiving palliative care. So it means it is really important to actually improve the palliative care so that most of the patients who are diagnosed with advanced cancer actually receive it. And what are the benefits? So there are three kinds of benefits. That is, there are physical benefits, there are psychosocial benefits, as well as there are spiritual benefits. Coming to physical, that it relieves pain, it manages symptoms, and also it lessens or elevates your discomfort. Coming to psychosocial, it provides emotional as well as mental support and fulfill your goals and desires. Coming to spiritual, it helps to finding purpose and the closure. And most of the times, we in our hospital we have a multidisciplinary team wherein a psychologist, sociologist, a physician, and also a physiotherapist, all put together they form a multidisciplinary team, work for the betterment of the cancer patient and also help the palliative care team. And palliative care prioritizes to maximize the quality of life and also manage the pain and the symptoms. And most importantly, it helps to increase the communication among the treating physicians and also coordinating the medical and supportive services as well. And what is the significance of the physiotherapy in palliative care? It helps to maintain an optimum respiratory function. That is, a physiotherapist makes sure that proper breathing exercises are being taught, because most of the times a palliative care patient is confined to bed and he's not able to move around. So usually whenever somebody is confined to bed, their respiratory secretions are very high. So I think it becomes really important as a physical therapist to address this respiratory component and teach them proper breathing exercises. And along with that, you prevent muscular atrophy. That is, try to do active movements or active assisted movements or passive movements and prevent joint contractures as well. And most of the times, because the patient is in one single position, there is a lot of evidence that tens also can be used for the pain control, which improves your quality of life and also the patient can be pain free. Thank you so much everybody for the attention. And then these are my references, which that is the definition, pathophysiology, and these are my references. And yeah, if you can ask me any questions, yeah. Yeah, I can see the questions. At what stage of the cancer treatment should physiotherapy ideally begin? So that is what, as we were discussing earlier, that is at the time of the diagnosis and from the time of the diagnosis and the treatment, that is the phase of the rehabilitation. So it is better to start the physiotherapy program in the initial phase itself, right at the rehabilitation program, once the disease is diagnosed, so that the treatment can be very effective and you will be able to achieve all the outputs. So once the cancer is diagnosed, then based on whatever the doctor tells, that is, usually there are three types of treatments. That is, once a patient is established with cancer, most of the times this treatment is either three types. That is, your chemotherapy, your radiation therapy, or the surgery. So based on the treatment which is needed, you can start your physiotherapy. And the next question is, what all interventions we can do for the excruciating pain which is associated with cancer, and how we use graded motor imagery to reduce the same. So usually things which we do for relieving the pain is most of the times post surgery, or if somebody is in lot of excruciating pain, we can use tens as well as some physical activity. Most of the times the pain even comes because the patient is confined to bed, or the patient is inactive. Certain pains will be there wherein the patient is inactive, or there is a contracture which is seen. So try to correct that and try to mobilize the patient and try to change the psychological aspect of the patient, and try to mobilize the patient, try to make the patient. Most of the times what we see in our hospital is try to shift the patient from the single room, that is you can go into a corridor, you can put him in little fresh air wherein again patient can feel better. So this is how again you can manage the pain. And most importantly, as I told you, because patient is in confined space, that is most of the times it's confined to bed, you can use a tense machine which is very effective for the pain reduction, as well as hot pack which can be used, or a cold pack, or some gentle stretching exercises also. Because most of the times what we see in our cancer patients who are having head and neck cancer are they will have lot of stiffness and contractures in your head and neck. So once you start teaching them certain exercises, that is gentle stretching or certain exercises, then automatically the pain is also reduced. What is the misconception about oncology rehabilitation that every physiotherapy student should know? The misconception is most of the times whenever somebody is diagnosed with cancer, most of the times people think that is the end of the story, but it need not be. Because there are a lot of success stories, and once a physiotherapist, and lot of people think physiotherapist's role is very minimal in cancer, but it is not like that. it Physiotherapists actually play a very key role in cancer rehabilitation, that is right from the diagnosis till the treatment and post recovery. There is a lot of scope for a physiotherapist in oncology rehabilitation. That is right from the diagnosis is, once in our hospital, I'll tell you our scenario. Once the patient comes to the hospital, the patient is referred to an oncologist. And if the treatment option is the surgery, then the patient is referred to an anesthetist, and anesthetist directly refers the patients to us, wherein we teach them the rehabilitation program. So that in this process, because it is very synchronized and it is streamlined, obviously the patient is very well aware that what will be the hardships post surgery, and how many days he will be in the ICU, and all these counseling is also done. So it becomes very easy for the patient also to recover, so that, and he'll be mentally aware that he'll have enough time which he's going to spend in the ICU, and again he'll be shifted to the ward, and what are the exercises which he needs to do before surgery itself, so that he'll be fit for the surgery. So when everything is streamlined, it becomes easy, and the outputs will also be fruitful. What And the next question is, what precautions should we take before starting the physiotherapy in a patient with chemotherapy? So most of the times, as I told you earlier, the most important factor would be assessment. We have to do a regular assessment along with that once, because most of the times chemotherapy is either it is on daily basis or all weekly. So assessment along with reassessment is very important. So a physiotherapist should not only should do an assessment when he is about to do, whether the patient is fit, and again he has to reassess the patient, so that he will be able to have the full knowledge about functional impairment, and how the patient strength is, and what is where is he lacking. So it will be easy. So assessment and reassessment should be a part of the journey. And what should be the approach for trismus and HN, both trismus in HN patient, both preoperative prevention and post-op? This I think I'll refer and let you know once. You can just mail me. And any evidence for the treatment of abdominal edema in breast cancer, especially after chemo port removal? Yeah, most of the times once the patient has chemotherapy port removal, there will be little abdominal swelling or which is seen like ascites or something, but most of the times it will be subsided once you start mobility exercises. That is, you ask the patient to walk a lot. I always tell my patients that during the surgery or an acute phase, always remember the intensity of the exercises should be low, but the frequency should be high. So make sure you teach your patient that intensity of the exercises, it should be minimal, but make sure he does it after every 2 hours, so that there will be less chance of edema as well as post chemoport removal. And what role does physiotherapy play in lymphedema management, especially after? So this is very common question, that is, what is the role of a physiotherapist if there is a lymphedema? So as I was telling you, even in the brochure it was written, lymphedema, if it is diagnosed, you cannot correct it fully, but early detection is always the key. So try to detect it very early, and teaching the patients what to do and what not to do becomes really important. Most of the patients, once they get discharged post mastectomy after the breast surgery, they start lifting weights or they do exercises very vigorously, which again triggers lymphedema. So I think we should be very careful to tell the patient what are the do's and don'ts, so that this lymphedema will not get triggered. And you can even teach manual drainage techniques, and also ask them, if you doubt that the patient is having lymphedema, ask them to buy the compressive stockings very early stage itself, so that they can manage lymphedema. And then you can ask them, if the patient is affordable, and if you can ask them to come regularly for the intermittent pneumatic compression, that is the lymphapress device, wherein you can treat the lymphedema. And in patients with bone metastasis, how do you balance the risk of pathological fracture against the risk of deconditioning from excessive activity restriction? So most of the times, how we classify is based on PET CT. You will know whether it is pathological fracture or there is a bone metastasis, because most of the times what we see is the patient had a lung tumor and it has got spread to bones, or there is a primary pathology which is somewhere else and then it has gone spread to bones. So again, or you will have vice versa, that is, you will have the cancer in the femur and then it slowly spreads to bone mets like lung and all. So you should be very careful once you have the PET CT. So you should be very careful in mobilizing such patients, because these patients are not very similar like THR or TKR. So you have to mobilize them very gently, and then teaching them, stick to basic exercises like teaching them the static quads, static hams, basic SLRs, and optimal loading should be done very carefully. Then you will be able to do the exercises. And what about the statement that movement could cause more metastasis of cancer cells? No, I think this statement, I think it's a myth. Movement could cause more metastasis of the cancer cells. There is a lot of evidence and there are a lot of systematic reviews which tells that even cancer patients should be physically active. And there is a systematic review which was, if I am not wrong, in my slide, that is, if you are physically active, that is, if there is enough movement which is happening in the body, there is a reduced risk of cancer. And also the recurrence of the cancer is also very low in patients who are actually doing the movement. So I think the movement should cause metastasis is absolutely a myth. And I think physical activity or a physiotherapy or being physically active actually helps the cancer patients who are actually getting treated, or who are actually, once they're recovered also. So I think physical activity should be done without any doubt. So what functional tests are most appropriate to judge the intensity and frequency? So most of the time, as a cardiopulmonary physical therapist, the gold standard test is your 6-minute walk test. That is, if the patient is able to, because even in rehabilitation program, we do this test in most of the patients, that is in CA lung patients or CA stomach, and CA colon. We do a 6 minute walk test and see his functional capacity, whether he's able to do, and we note down the functional capacity baseline, and post surgery when he comes for a review, again we try to match the functional recovery, whether he's able to maintain, or whether the basically 6 minute walk test is an outcome which tells you whether the patient has recovered from the surgery or whether the patient has deteriorated post surgery. So it really becomes important as a physical therapist that you try to go into intricate details and try to document, because data is something which is very important, and once you can cross check and compare, then you will be able to judge better and do much more your rehab effectively. And what skills or certificates should a physiotherapy in oncology rehabilitation? Now the skills are the most importantly, if you are a young therapist. Now I am working in this single specialty cancer hospital. It's been 5 years now. I have learnt a lot. Only what I believe is your experience and the way you see patients in and out, because most of the times what I actually learned is, again, not every article you read will always mimic your patients. It is, articles are different, and again treating patients one on one is different. It might be little different again. So I think once you get exposure, you start learning new things, then you apply your knowledge. Then e-certifications, I don't think so. Once your basics are strong, you're able to do an assessment. And make sure, I tell all my students and colleagues also, that once your assessment is done, it will be there at least for 2 3 days, but make sure once the patient gets shifted to the ward, or from the ward the patient is coming back to the ICU, or he is getting discharged, make sure you do a reassessment so that you will know his functional capacity, and based on that you can give a home program. So I think understanding the patient's physical symptoms or his functional capacity is really important. And radiation therapy, can physio also be prescribed on patient? Most of the times, if the patient is, this radiation therapy, most of the times we see in head and neck cancer patients, yeah, physiotherapy is suggested, but very gentle stretching exercises, because most of the times, even if you see a lot of articles, or even you see patients who in our head and neck department, whenever you have the radiation to the buccal mucosa or at the neck level, you will have, your skin is very brittle, and you have a lot of stiffness component which is involved. So rather than along with physiotherapy, you ask the patient to hydrate himself very nicely, because hydration, again, most common thing which happens in radiation is your dehydration. So asking the patient to get hydrated and teaching him gentle stretching exercises, or to maintain his range of motion, that is enough. You need not actually start strengthening very early. So gentle stretching exercises would actually help. Then the next question is palliative rehabilitation for patients having skeletal mets and lung mets to improve independence. Yeah. So most importantly, as I told you, that is, to palliate means to lessen the severity. It is, we are not here to address the disease or to neutralize the disease. We are just here to make the patient feel better. So as I was telling you, that exercise will have a good positive impact on your mood. There are feel good hormones which get released. That is, whenever you do an exercise, your endorphins and enkephalins also release. So I think even if the patient is in palliative department, or he is bedbound, so slight exercise, making him, just making him sit at the edge of the bed, trying to teach him certain breathing exercises, also helps the patients massively. So it becomes really important that the role of the physiotherapist is finely tuned in the palliative medicine as well, so that the patients would get benefited. And what is the time period of rehabilitation? So it is always, it is not any rehabilitation, I don't feel it is very time bound. Most of the times there are articles which talk about MCDC, that is minimal clinical detectable change. If you start an exercise, it will take at least 6 to 8 weeks for you to see the slightest possible difference. So usually whenever you want to start, if assume if you start with the strength training for a mega prosthesis case, that is, if a patient had osteosarcoma femur and then he has been operated with the mega prosthesis, then you started strengthening hip, quadriceps and the hamstrings. So even in this you will have 6 to 8 weeks which you have to spend very wisely and consistently to see the difference. So that is called minimal clinical detectable change. So it was a nice thing to know about physiotherapy as a part of but so as of now, constipation and physiotherapy after chemotherapy, most of the times it is managed medically. And what we tell is, if assume it is not only for constipation after chemotherapy, if a person is in bed, a healthy person like you or me, if a person is in bed, his bowel and bladder functions will go for a toss. So the most important and the most underlying statement which no doctor will tell you is the movement. So that is what, as a physical therapist, I tell my patients, that is, movement is the medicine, and try to keep moving, wherein you will have these bowel movements which can be triggered, so that this constipation pain will also get addressed. So yeah, can you share a feel good story? So we had a patient. He was operated. He was a very young patient. I still remember. He was operated for his osteosarcoma femur, and he was very poor as well. The parents were also not able to afford the cancer treatment, but we made sure that he stayed somewhere very close by, and eventually he used to come. Uh, he had an amputation, above knee amputation, unfortunately, and he was a very young boy who was almost like 12 to 14 years old. And then he used to come to mirror therapy on a regular basis, and suddenly he, after like 4 or 6 sessions, he started telling me. I asked him if you can rate your pain or how do you feel after this mirror therapy, because we actually started giving a lot of attention to that small boy. Then he started telling me that definitely his pain has come down. So I think that would be a feel good story. And then again, I wanted to show you, even if I can share my PPT. That is, 1 second. I can just share my PPT, wherein I have again this video, which she was a post amputate patient, and again we started making her not the ADLs, but also she became quite independent after that with the crutches and all, and she was also very happy post this thing. And she was a young girl but mentally very strong. So yeah, this was again one of the story which I wanted to share. And then yeah, so post-op cases, what is the role in CA cervix? That is, in most of the times, post-op cervix is, you have to teach most of the times these core exercises. Kegel's exercise again becomes very important, that you need to teach them. And post-operatively, usually these patients are quite they are able to do all these. They're quite independent and they have good strength. So most importantly, consistency. Most of the times, a lot of patients, actually we tell them to do a lot of exercises, but again patients only do for few days. So I think it becomes really important that patient actually does it consistently, and then you will get the result. And what is the role of physiotherapy in leukemia patients? So even in leukemia, yeah, as I told you, the most important symptom was the cancer related fatigue. So in leukemia especially, I have seen patients in neutropenic ward, wherein the post bone marrow transplant, or a patient who is about to get bone marrow transplant. So it becomes really important as a physical therapist to address the fatigue component. So it becomes really important to teach certain exercises, breathing exercise as well as some strengthening, wherein your cancer fatigue can be addressed. So whenever you are talking about a condition, you always make sure that what are the signs and symptoms of that particular condition, wherein you can do a, as a physiotherapist, make sure you are having a short term goal and a long term goal, and then based on that you can do your rehab. Yeah. I think I have answered. One question is still there, that is trismus in head and neck cancer patients. That is, most of the times these head and neck cancer patients, we most of the times, if there is any surgery, we try to mobilize the head and neck cancer patients very gently, and then if there is a radiation and there is a trismus factor, then you try to teach them gentle exercises and stretching exercises. These also will help the patient. I hope I answered most of the questions. If there are any more questions, you can let me know.
Ma'am,
Yes, ma'am.
sir will cover all the questions now, ma'am.
Hello. Yeah, I have seen one more question, that is, can heat therapy be applied after radiation? Usually after radiation we try to avoid any heat therapy, because most of the times post surgery or radiation therapy, already there is a lot of inflammation, and then even, and then if you put heat on top of the inflammation, it will get further inflamed. So I think ice pack, I would recommend, is the best line of treatment immediately after radiation rather than heat. Yeah, heat therapy should be absolutely avoided. Thank you. So I've, again there is a new question, that is, yeah, you can, I'll share the PPT, then any reference to go through the prehabilitation, I'll probably share the PPT, which again it will be there in the YouTube. You can just go back to the reference, because for this prehabilitation I have taken it from the systematic review, as most, I think most of them are students, or if they are practicing physiotherapists, you will know what a systematic review is, because it is the highest level of evidence. So I have taken this prehabilitation program from a systematic review, so I think you can use this. And again, coming to the last question, that is, what is the scope of oncology physiotherapy? So I think the scope in the oncology physiotherapy is very, very high as of now, because in the second slide itself, I was telling what is the prevalence of the cancer in the modern times, because everything got adulterated, right from the food, right from everything. There are so many cancer patients, and unfortunately, India is the third highest in the incidence of the cancer. So I think it is everybody's responsibility to prevent and to take necessary measures to prevent cancer, as well as you should be very well aware that what are the early signs and symptoms your body is giving which can lead to the cancer. So I think there is a very good scope, and even clinical and as well as in the academic setting. Most of the times in our physiotherapy regime, I think it should be added, is what I feel, that is your oncology topic also, so that students as well as clinicians who are actually practicing will also be aware of the cancer settings. Because what I have seen is oncology doesn't just come from the bookish knowledge, that is you need to practice it day in and day out, wherein you are supposed to see patients, then you will be able to understand better. So I think rather than studying or going through articles, you try to see a lot of patients, try to get exposure, try to see what kind of different interventions you can use, and what are the difficulties in the, what is the problem list of each and every patient, and then jot it down and try to set a tailor-made approach to each and every patient. See, no two cancer patients will be the same patients. No two breast cancer patients will also be same. So they will react in a different ways. So it becomes really important to address each and every case as a tailor-made approach, and then you will be able to do better. Yeah. Thank you so much. I think I am also running out of time. I need to, I'll hand it over to Pravina. Yeah.
I think sir will cover all the questions, ma'am.
Yes, ma'am, you may proceed further.
Yes. Ma'am.
Yes, ma'am. Hello.
Yes, ma'am.
Please proceed further, ma'am.
Okay, okay. On behalf of all the participants, I would like to express our sincere gratitude to Dr. Nikhil Chakravarthy for delivering such an informative and inspiring session today. I would like to thank IIP Digital Media team. I would like to thank IIP President Sanjuja sir, National Head IIPWC Ruchi Vashni ma'am, South Zonal Head IIPWC Prabha Vinodini ma'am, State Coordinator IIPWC Surabhi ma'am, State Joint Coordinator IIPWC Gomati ma'am, State Sub-Coordinator IIPWC Shalini ma'am, State Sub-Coordinator IIPWC Anuradha ma'am, State Sub-Coordinator Dr. Neelima ma'am. Your valuable insights, extensive clinical experience, and practical approaches have greatly enhanced our outstanding of physiotherapy and rehabilitation. The knowledge helps us in our professional growth and improve patient care. You truly appreciate the time and effort making this webinar success. Thank you for patiently answering our questions and sharing your expertise with us. I would like to thank all the organizers, coordinators, and participants for their support and active involvement throughout the session. Once again, thank you, Dr. Nikhil sir, for wonderful presentation.
Thanks so much, ma'am. Thank you, Dr. Nikhil sir, for having this extremely amazing webinar and very informative. It was a very nice question and answer round.
Yes, ma'am.
I would just like to update about a small WP, the World Physiotherapy Conference, the a regional conference that we are going to be conducting in the month of September.
Yeah,
There
yes,
is curtain raiser of this conference, which is to be conducted by the state of Maharashtra, state team of IAP and IAPWC. So Maharashtra State IAP and IAPWC is presenting a curtain raiser of World Physiotherapy, that is Asia Western Pacific Regional 2026 Conference. Rehab Tech Nexus is the title. That is Physiotherapy for a Healthier Tomorrow. So this is also commemorating 70 years of IAP at its Janmabhoomi.
okay.
So, and this conference has joined hand with Government of India for Fit India. This is going to take place on 12th of July 2026. The one-day conference that is from 9 a.m. to 5 p.m. at Terina Auditorium, Navi Mumbai. I would like to update all the participants regarding this. We would share the details with Praveena ma'am, and ma'am, you may share it ahead for the registration. The registration fees is 500 for MPT students, and for office bearers of IAP and IAPWC, the registration is free of cost. So
Okay.
this is going to be a curtain raiser for World Physiotherapy, that is Asia Western Pacific Regional Conference of upcoming in 2026 September. So on 12th of July, there is this one-day conference that is to be conducted. And this is your chance to experience the knowledge, skill, and networking at their finest. So all in one dynamic gathering it is going to be. So I would motivate all the participants present over here to look into and kindly join us at this conference. Thank you so much. And thank you for today's webinar, Praveena ma'am, your
Thank you so much.
coordinator, Dr. Ramya ma'am, and the state heads and the state joint coordinators and sub-coordinators. Thank you for having us. Thank you all the participants and present on YouTube Live, present on Zoom platform for joining us for this webinar. Thank you so much, everyone. Take care. Have a good day.
Thank you so much.